Good evening. My name is Leticia Lozano. I am the Health Center Manager for the Achievable Foundation. I would like to say how honored I am to be able to share my learning journey with you guys today. I have been in the healthcare field for 13 years now, and 2 out of those years have been with the Achievable Foundation. The Achievable Foundation was founded in 1996 to provide support services to clients with developmental and intellectual disabilities. These services they were not able to receive from the Westside Regional Center. There was a gap in care for these clients at the time. They needed a health center that provided quality and culturally appropriate care. And this is how the Achievable Foundation opened its health center in September of 2013. It became an FQHC in November of 2013 with its mission to improve the quality of life for children and adults with intellectual and developmental disabilities living in LA County by providing support and healthcare services, allowing them to live healthy, independent, and productive lives. We have multidisciplinary providers. We have family medicine doctors, pediatricians, a psychiatrist, psychologist, and a pediatric neurologist. Before I start with my learning journey, I wanted to paint a picture for you. To do that, I picked a picture. This is Timothy. He's 6 years old with a developmental disability coming to the Achievable Foundation. His pediatrician felt it important for him to have an MRI of the brain. The referral coordinator submitted this referral through the treatment authorization form, it's called a TAR or request, to the Medi-Cal website via paper, and it needed to be mailed. Unfortunately, she kept getting denials. When this first came into my hands, I didn't hesitate to put on my fix-it hat and run with it. And when I did, I reviewed the chart, verified the information, but instead of submitting the treatment authorization request via mail, I went to the Medi-Cal website and submitted it electronically. I got the approval within 2 to 3 weeks, and Timothy was able to get his MRI scan. But we got another bottleneck. We were not able to get the consultation note on time. So this is where my project kicks in. I wanted to improve the referral process for our organization. We had a problem. We had a high number of referrals that were left incomplete. They were because the patients weren't scheduling their appointments or because the specialists were not faxing us those consultation reports. So my goal was to increase the completion of referrals in less than 120 days. To do that, we mapped our referral process to see where we would find bottlenecks and where we would find key stakeholders that would help us with our process. We found that we needed a recall process, and that's the first thing we implemented. We did a 60-day referral recall for patients to not only remind them of the referral that was pending, but to see if they needed help with scheduling their appointment or finding a location that was closer to them. We also implemented a 90-day recall for the specialist. Initially, we called them, and that required a lot of resources, and unfortunately, I couldn't dedicate a staff member to do that. So we looked at volunteers, but they weren't consistent. So instead, we implemented a specialty fact sheet to obtain those consultation notes. So when we would do a 90-day recall, we submitted the specialty fact sheets to the providers, and we received a very good response. This led me to realize that the Managing to Leading program was a huge opportunity, not only for myself, but also for my cohorts. It provided me the opportunity to tackle this problem head on and really dedicate the time to make sure that it was successful. I was given so many tools during this program. The Myers-Briggs was able to help me understand what it means for myself and also for my direct reports on how we need to communicate. and sometimes how we need to change our communication styles to really relay the information that we want to convey. Communication and active listening techniques to make sure that I'm providing my undivided attention to the staff, because sometimes we try to multitask and we do 3 things at once and we are not listening to what they're saying when they're coming to us. And then we were given executive coaching and coaching calls that provided the support and resources to make sure that we were on track with our program. With our leadership growth and our projects. I was able to understand financial documents and constraints, because whenever something doesn't work out well, the first thing they want is additional staff. But unfortunately, sometimes your budget does not allow it. So I was able to see what can I do to work with the resources that I did have to make my project successful. And also the networking perspective. I'm an introvert, so it's hard for me to network. So coming into this program, I was able to start with my cohort and really introduce myself to them and allow them to introduce themselves to me, use them as a resource, and provide myself as a resource to them as well. I was given the opportunity to participate in a pod. My pod was the Incredibles. From day one, we dedicated ourselves to make sure that we met monthly. And we will continue to meet after this. They provided feedback, suggestions, and support. And that was also an additional key aspect to why my project was so successful. And I thank you. My lessons learned throughout this program: I learned to work smarter, not harder. Like I said before, I didn't hesitate to be that fix it, run with it, do it myself, because I can do it faster. But that was hindering my staff's growth. And I really wanted to engage them and keep them involved in my project, because that was the only way that it was going to be successful. So I learned to actively listen, stop talking, and really listen. And think of the questions that I can ask them to lead them to their own solutions. So I was able to engage them and have them figure out how they wanted to use the tools that we implemented and how it would work best with their process. So I know my leadership journey is not over yet. Even though this program will be over soon, my leadership journey will continue, and I hope that I am able to bring my staff along with me with that journey. So before I go and end my presentation, I wanted to leave you with this. If you want to go quickly, go alone. If you want to go far, go with others. Lastly, I would like to say thank you to my cohort for going on this ride with me, to my pod for providing me that support, to the Achievable Foundation and my manager for providing me the opportunity to participate in this program and really dedicate the time that was necessary, to UCFS and Cedars-Sinai Community Clinic Initiative for providing this opportunity not only to myself but to the rest of my cohorts. Thank you.